My name is Nathan Kaplan. I'm an orthopedic surgeon who specializes in hip and knee replacement and adult reconstruction. Patients come to see me for all sorts of different pathology that involves the hip and the knee. It ranges from residual symptoms from an acute injury that occurred 6 weeks prior to their presentation to arthritis that a patient has been living with for years and years. I'm not born, but definitely raised in Rochester, New York. I grew up in the Brighton school system, did most of my schooling locally, and then stayed local for even my schooling beyond high school. I went to Geneseo for undergraduate, Buffalo for medical school, so I'm an upstate New Yorker for life at this point. An early experience in volunteering, again as a requirement through my early schooling, was in orthopedics. I happened to shadow a good friend's father who was an orthopedic surgeon, and he largely did hip and knee replacements for patients. And one of my questions was, how does this work? How does it help people so much? And that experience really fostered my interest in helping patients through having a problem, asking a question as to how to solve that problem, and then ultimately solving that problem for patients. And then that interest in hip and knee replacement continued. What I try to do is help to work with you as a patient to come to a guided, consensual agreement about where you would like to go to treat the problem that you're experiencing. I want patients to feel that they're provided the full list of options that are available, discuss each one in depth if need be, weigh the pros and cons, and ultimately come to a team decision about what the best way forward is. So I really do focus and value treating a patient from a bird's eye view, taking the whole picture into account, and then seeing how your hip or knee pain fits into that. I want to make people better as a person as opposed to just fixing their pain.